Most people say that the pandemic is over, but I say American healthcare workers are still sick. Most of us fall somewhere on the spectrum between pandemic related burnout all the way to full on PTSD. COVID affected us differently because we lived it at work and at home. In 2020, I had one nurse, Mary, who was working 16 hours a day to help cover the demand for more nurses to staff our COVID unit. Mary could only work on the COVID unit because she had been exposed to the virus by her family. She stopped by the house one day before work to check on her sick parents. Mary found her father gasping for breath, and she noticed a thin blue line around his lips. His fingers were cold to the touch, and she had no way to check his oxygen saturations. There was no oxygen in the house. He had always been healthy. So she told her mother, who was also ill, to call 911. As the paramedics rolled the gurney up into the ambulance, Mary caught just a glimpse of her father's frightened face. Then she came to work. Her father was admitted to the hospital that day, and her mother was admitted soon afterwards. That quick visit was the last time she saw either one of them. For the next 2 weeks, while her parents, in separate hospital rooms, lay dying alone, Mary cared for other people's parents who couldn't visit them either. There is nothing normal about that. COVID stressed America's healthcare workers in a way that still affects us to this day. So, we at If These Scrubs Could Talk are gathering stories for our future book, COVID, If These Scrubs Could Talk. All healthcare workers from every field of medicine, not just nursing homes, are invited to submit their stories for consideration for publication. This book is about recording a very bizarre period in medical history on a very personal level. It is a way of paying tribute to our healthcare workers who were boots on the ground, and it is a way of healing. Putting your experience on paper gives it validity and permanence. Storytelling is cathartic for both the writer and the readers, and your words could be exactly what someone else needs to feel seen, understood, and less alone.